Hi, my name is Greg Felt. I'm Director of Public Health for Sheffield. This is a situational update for the 24th of February 2021. Firstly, epidemiology. The rate of infection measured by the seven-day instance is still falling but beginning to settle, beginning to plateau and flatline. As of today, rates are in the order of 120 per 100,000, and they've been fairly steady at that for the last few days. That might be a temporary effect, or we may see further reductions. It's impossible to tell. So 120 people per 100,000 residents are given a positive test in any given 7-day period. So there are 600,000 people or so in Sheffield, so six times 120. The rates continue to fall in the elderly. That's obviously great news. That's the group that are most likely to be seriously ill. Encouraging signs recase rates in the elderly after the vaccination. Of course, the lockdown is having an impact on case rates, no doubts about that. And the elderly are the most cautious and they're most likely to be at home. So that will also have a bearing. But increasingly, both nationally and beginning locally, there's lots of encouraging signs of the evidence beginning to stack in the way that there was expected. That the being vaccinated significantly reduces risk of serious illness and death, and obviously that's good news for all sorts of reasons. Further good news is that the vaccination seems to reduce transmission. And again, that was one of the uncertainties a month ago, which plain didn't know that. Evidence in both Scotland and England and Israel, where it's a little bit ahead of us, is beginning to stack up that being vaccinated reduces the ability to transmit the virus to others. And that's obviously really good from an epidemiology perspective and a transmission perspective. Still, care is needed. We definitely should avoid enabling unmitigated transmission in the non-vaccinated population. Still, significant numbers of people in Sheffield population haven't received first dose, never mind 2 doses of vaccine. Three reasons. There's an appreciable risk of hospitalisation. Even in younger people, there's still a risk of hospitalisation. We want to avoid that. Risk of long COVID. Every infection carries the risk of long COVID, and that's a non-trivial risk. And of those stories of long COVID I've heard about, it's not something that I would wish on anybody. And finally, there's a risk of mutation. Every time the virus transmits from one person to another, or every time it replicates, actually, there's a risk of further mutation. The B117, or the Kent variant, is the most dominant in Sheffield. There's no sign yet of the South Africa or the Brazilian Manaus variant. That's probably a matter of time. So again, we will be careful and very watchful for that. The Prime Minister's announcement earlier this week, the publication of the roadmap out of lockdown restrictions, was fabulous news. It was long expected. There are 4 steps in total. And 4 tests that will be taken for each of the 4 steps. And between each of the 4 steps coming out of lockdown, we'll reach step 4 by summer. At the earliest, I think, there'll be a 5-week window to assess progress against each of the measures that have been unpicked or released. So the 4 tests are that the vaccine deployment continues successfully. There's good evidence that vaccines are being effective in reducing hospitalizations and deaths in those that are vaccinated. And as I say, thus far, that evidence is stacking up quite well. Infection rate as they are, don't risk a surge in hospitalizations that would put unsustainable pressure on the health and social care system. Each time we unpick an element of the lockdown, there will be an upward pressure on infections. There's no 2 ways about that. And that the government's assessment, the 4th test is the government's assessment, is not fundamentally changed by new variants of concern. And that is an unknown to all of us. So we'll need to bear that one in careful consideration. Clearly, it's great news. But for now, I think my ask is that we remember nothing has changed. We are still in lockdown. The first thing that will reopen will be schools in early March. That's a good thing. But as of today, rates are still high. R is just below 1. every one infection begets at least one, just less than one more infection. So rates are going down quite slowly. And it's important that everyone continues to follow the rules. And sorry, we do want a light at the end of this tunnel. Me too. But equally, we don't. We don't want another significant surge in infections, and the potential for that is there. So please do continue to stay at home. Please do get a test if you have symptoms, and self-isolate if needed. What you do has mattered, has made a difference, and continues to matter, and it helps us all stick to the roadmap so we get back to some semblance of normality as quickly as we can. The vaccination programme is going well. Here in Sheffield, since the beginning of the vaccination programme, we've now vaccinated 163,000. That's an astounding effort to stick that many needles in that many arms so quickly. Is undoubtedly an astounding effort. People who are aged 16 to 65 who are clinically vulnerable are defined as having an underlying medical conditions have now started to the next group and have started to receive their first COVID vaccinations in Sheffield last week. In addition, we're also vaccinating those who are 65 to 69-year-olds. So those are the next two cohorts that we're focusing attention on, and this is going really, really quickly, actually. So undoubtedly, it's the biggest vaccination programme the NHS has ever undertaken. The whole of the city, all of the agencies in the city, across the council, the NHS, and the voluntary and community sector and the faith sector is supporting that. It's a big, big effort, and will take some time to get through all of the intended vaccination cohort. Please don't call your GP to inquire about when your turn will come. You will be asked. It's worth me saying that we have started vaccinating new cohorts of patients, but if you're over 70 or are in the clinically extremely vulnerable group, defined as the shielders, or are a frontline health and social care worker that haven't yet had the vaccine for whatever reason, it's not too late. You can call now to book a vaccination appointment online, or call the free phone number on 119, and the details will be available at the end of the video. Lastly from me, where next? Nationally, the Office of National Statistics data is still showing nationally that the rates are coming down reasonably quickly and no tailing off nationally, which is good news. So we may start to go down again in Sheffield. The symptom trackers, most commonly the Zoe app, is beginning to show that the decline is tailing off. It's not the strongest data, but it is data. We take that quite seriously. And as I say, looking at the over 80s case rate data, that's beginning to fall off faster, thus a good indication that the vaccination is doing what we all hoped it would be. We will be pursuing the same strategy as we've had almost from the start. The basic public health and hygiene measures, washing your hands, keeping a distance, wearing your face mask, those will be in place for some time because there's still a lot of infection around. I'd like to be pursuing a zero COVID strategy, but it's probably unattainable. So we're pursuing the lowest possible rate that we can get to. The end is probably a long way off. I'm sorry to say. It will be when we've got very, very low community transmission measured by the 7-day infection rate. Currently, as I say, it's about 100 to 120 per 100,000. Last summer it was 20 per 100,000. So it's a good way to go there. R is well below 1. Currently, it's just below 1, and a well-vaccinated population, clearly that will come quite soon. So the roadmap has much to welcome. It really gives us light at the end of the tunnel. But we will be living with COVID, I think, for some considerable time to come. So when we get to the stage 4 of the roadmap, when we can fully reopen society, there will still be some measure of public health interventions because we will still be living with COVID for some time to come. So I don't want to end on a note of doom and gloom. I think it's important I end on the note of realism, but collective action has made a difference, continues to make a difference, and I think we will be in that space for some time to come. So thank you to Sheffielders for your continued efforts, because it really, really does make a difference.